let's Bismillahirrahmanirrahim. So today we learn about antiviral drugs. So what's the introduction of virus? Viruses are obligate intracellular parasites. So basically they are parasites. Their replication depends primarily on synthetic processes of the host cell. Yet they depend upon the host cells. Effective antiviral agents inhibits virus-specific replicative events or preferentially inhibit virus-directed rather than host cell-directed nucleic acid or protein synthesis. There are two types, enveloped virus and non-enveloped. You can see in this picture, enveloped virus. They have enclosed within a lipid membrane, which is sensitive to heat. And second, non-enveloped virus, lack or bilayer lipid membrane, they are heat resistant. That's why nowadays we say that this coronavirus is a heat resistance virus. That's why maybe it is a non-enveloped virus. So if you go through the classification of antiviral drugs, first one is anti-herpes virus. So that's the drugs. Mostly we have to apply adoxoridines, acyclovir, famciclovir, ganciclovir, cidofovir, foscarnet, that formivirine, trifluridine, valaciclovir, veglanaciclovir. So mostly in these drugs, yes, they are drugs, but mostly acyclovir is mostly used for anti. You may have learned the name of acyclovir. That is the most common drug for anti-herpes. These are still the other have also some action, but mostly the widely used drug is. You have to remember. If I ask them antivirus, virus, you can say that it is a acyclovir mostly. Then most of influenza is a viral disease. So anti-influenza virus are amantadine, ramantadine, oslamivir, and zenamivir. These are against anti-influenza. Mostly in this, you can learn about amantadine and ramantadines. These are mostly applied against anti-influenza virus. Then anti-hepatitis virus. It is a non-selective antiviral drugs. So then A is for anti-hepatitis, primarily for hepatitis B, there's a lamivudine, adifovir, dipivoxil, tenofovir. So mostly in this category, lamivudine is used primarily for hepatitis C, ribavirin, and interferon alpha. Then we go for antiretrovirus. So A is nucleoside reverse transcriptase inhibitors. The drugs are zidovudine, diadonosine, stavudine, lamivudine, abcavir, emtricitabine, tenofovir. So mostly this nowadays zidovudine is used against these viruses. Then non-nucleoside reverse transcriptase inhibitors are nevirapine, efavirenz, delaviridines. Then protease inhibitors, ritonavir, atazanavir, lendivir, nelfinavir, secnavir, amenavir, lopinavir. Then fusion inhibitors, enfuviridine, enfuviritide, CCR receptor inhibitors, maraviroc, integrase inhibitors, raltegravir. So these drugs are mostly where viruses are erupted or where they endemic, these are used, but mostly these drugs are available. Now you can see where the virus infections are found in your body. In the body of the human being, the various organs are being infected. So in organs where you can see very closely this picture, that various type of virus like bacteria can invade over the human beings, or so what type of diseases, what type of virus are there. So if you go through first to the brain, they may produce encephalitis, meningitis. The virus are responsible for this, maybe JC virus, measles virus, LCM virus, arbovirus, rabies. On left side, you can see first, I'm starting from left side. Then you go, the disease for common cold, there's rhinoviruses, para-influenza viruses, respiratory syncytial virus, respiratory syncytial virus. Then we go for pharyngitis, for throat. So for throat, there are adenovirus, Epstein-Barr virus, cytomegalovirus. Then for gingivitis, in mouth, herpes simplex, type 1. Then we go cardiovascular system. On cardiac area, there is a Coxsackie B virus is there and act over the cardiovascular system. Then go for hepatitis on the liver. The hepatitis virus are type A, B, C, D, E. H is there also, I think, may know, the H is also there. These act over, affect the liver. Then skin infection, mostly when there is a virus effect over the skin, so they produce varicella zoster virus, human herpes virus 6, smallpox, molluscum contagiosum virus, human papillomavirus, parvovirus B19, rubella, measles, coccygeal A virus. So on right side, if you go through, or if they go through eye, the virus which act over the eye. These are herpes simplex virus, adenovirus, cytomegalovirus, then parotitis, mumps and virus act over there for pneumonia. You can see influenza virus, type A and B, parainfluenza virus, respiratory syncytial virus, adenoviruses, SARS, coronavirus. Then you go for this myelitis. Here there is a poliovirus, HTLV1. Then gastrointestinal tract over there. There is adenovirus, rotavirus, norovirus, astrovirus, coronavirus. Then on, if they on pancreas, there Coxsackie B virus. For sexually transmitted diseases on these area, there is herpes simplex type 2, human papillomavirus, HIV. So these are various organs on which different type of viruses produce infection. So the entered over here. So then viruses are different from other microvirus because a virus cannot replicate on its own. It must attach to and enter a host cell. That's why I told you these are the parasites. It then uses the host cell's energy to synthesize protein, DNA, and RNA. Further, there you can say that viruses are difficult to kill because they live inside the cells. Any drug that kills a virus may also kill cells. Then antivirals are antiviral therapies. First is cytomegalovirus. I told you, you can see in that picture. Hepatitis viruses, herpes viruses, human immunodeficiency virus, HIV, influenza virus, the flu, respiratory syncytial virus, RSV, then SRS virus, that is the coronavirus. Antiviral drugs. So viruses have no cell wall and made up of nucleic acid components. Viruses containing envelope, antigenic in nature. Viruses obligate intracellular parasites. They do not have a metabolic machinery of their own. What they do, they use host enzymes. So antiviral drugs. Certain viruses multiply in the cytoplasm, but others do in the nucleus. Most multiplications take place before diagnosis is made. Now the antiviral medicines. First is antiviral drugs used to treat infections caused by viruses other than HIV. The first category is the antiviral, which act against the virus other than HIV. antiretroviral drugs used to treat infections caused by HIV, the virus that caused AIDS. So for AIDS, there is a antiretroviral drugs. Herpes simplex viruses, for such as HS11 oral herpes, HSV2 genital herpes, varicella zoster virus, there are chickenpox and shingles. Then antiviral drugs, non-retroviral. So mechanism action first is what they do. They inhibit viral replication. They stop the replication of virus. Then they used to treat non-HIV viral infections. First is influenza viruses, HSV herpes simplex virus, VZV, varicella zoster virus, CMV, cytomegalovirus, hepatitis A, B, C, HAV, HBV, and CV. Now, what are the adverse effects? Whereas with each drug, healthy cells are often killed also, resulting in serious toxicities. So antiviral drugs, current antivirus agents do not eliminate non-replicating or latent virus. Effective host immune response remains essential for the recovery from the viral infection. Clinical efficacy depends on achieving inhibitory concentration at the site of infection within the infected cells. So antiviral drugs are anti-herpes virus agents. For herpes, you can have the mostly acyclovir is used. Other are also, as I've given you previous names of these, other than acyclovir, the others also, but mostly the most important is acyclovir. Then antiviral drugs, acyclovir and congeners. Similar like congener means similar like acyclovir. There's a velaciclovir. It is a prodrug of acyclovir with better bioavailability. Then similarly, there is a famciclovir is hydrolyzed to penciclovir and has greatest bioavailability. Now, penciclovir is used only topically, whereas famciclovir can be administered orally. Now, the main drug which we have to discuss in antiviral drugs is the acyclovir and its congeners. So you may have seen this acyclovir injectable form. So if there is acyclovir, valciclovir, ganciclovirs, famciclovir, penciclovir, all are guanine nucleoside analog. Pharmacokinetics of acyclovir. Its oral bioavailability is 20 to 30% reach to the system. Distribution in all body tissues, including central nervous system. They have also renal excretion up to 80%. Half-life is 2 to 5 hours, means you have to repeat the dose after 6 hours. Administration, they can be applied topical, oral, and intravenous. Its adverse effects of acyclovars, ganciclovars, they may produce nausea, vomiting, nephrotoxicity, diarrhea, crystalluria, hematuria, and renal insufficiency. Myelosuppressions, neutropenia, and thrombocytopenia may be produced by ganciclovir. Therapeutics, where they apply. Acyclovir is the drug of choice for HSV genital infections. Then HSV encephalitis. And HSV infections, immunocompromised patients. Ganciclovir is the drug of choice for CMV retinitis and immunocompromised patients. Prevention of, they can be used for prevention of this. CMV disease in transplant patients.
सर CMV क्या फिर से आप रिपीट कर दें?
अभी फिर मैं आऊंगा, आखिर में आपको बताता हूँ, पीछे मेरे सारे नाम बता चुका हूँ ना।
तो सर इस लेक्चर का नेम क्या है?
बेटा बात में आई है, मुझे आखिर में पूछना।
खुद ही पढ़
Okay.
लेंगे.
आपको एंटीवायरल ड्रग्स का इसमें आ रहा है हेडिंग एंटीवायरल ड्रग्स. Respiratory viral infections, they may cause influenza. The drugs are choice over here Remantadine, Oseltamivir, and Zenamavir. So they have RSV, they were bronchiolitis, and there is a ribavirin drugs. The antiviral drugs may mostly amantadine and remitadine are used for influenza. First, they use for prevention and treatment of influenza A. What they do? Inhibition of viral uncoating by inhibiting the viral membrane protein M2. The influenza A virus can be given for amantadine. Amantadine is also used as an Parkinsonian effects. Then pharmacokinetics of this amantadine is that what they do, the oral bioavailability is 50 to 90, means 50 to 90% reach to the systems. Amantadine cross extensively blood-brain barrier, whereas Remantadine does not cross extensively. So the route of administration is oral. Then antiviral drugs, neuromanidase inhibitor influenza for further oseltamivir. So what they do? Influenza contains an enzyme neuroamidase, which is essential for the replication of the virus. So what they do? They prevent the release of new virion and their spread from cell to cell. The antiviral drugs mostly for influenza is neuromanidase inhibitors. These are effective against both type of influenza A and influenza B. Do not interfere with immune response to influenza A vaccines. Can be used for both prophylaxis and acute treatment. Neuraminidase inhibitors for influenza, oseltamivir, what is it? It's orally administered, maybe in the form of syrup or tablets. So zanamivir is given intranasal through the nasal cavity. There can be risk of bronchospasm with zanamivir. So for ribavirin, ribavirin mostly used in these drugs. It is a guanosine analog inhibitor of RNA polymerase. So antiviral spectrum is DNA and overact over the RNA. Viruses are susceptible, including influenza, parainfluenza viruses, RSV, and Lassa virus. Antiviral drugs, ribavirin is used and for RSV, distributed in body tissues except CNS, administration, oral IV, and inhalation in RSV. They may produce anemia and jaundice are adverse effects. So not advised in pregnancy. Then therapeutic use of ribavirin. Ribavirin is the drug of choice for RSV, bronchiolitis, and pneumonia in hospitalized children, may be given by aerosols, and for Lassa fever. Ribavirin is an alternative drug for influenza, parainfluenza, measles virus infections, and immunocompromised patients. So hepatitis viral infections, mostly it is used in hepatitis C interferons. So mostly the drug is lamivudine, cytosine analog for hepatitis B virus. Entacavir, guanosine analog for hepatitis B virus. So lamivudine resistance strains. This is now drug given in the oral form. Ribavirin also added with this hepatitis C with interferons. So antiviral drugs mostly for hepatitis C, and C is used interferon in the injectable forms. So interferons are natural proteins produced by the cells of immune system in response to challenges by foreign agents such as viruses, bacteria, parasite, and tumor cells. So antivirals immune modulating and anti-proliferative actions. These three classes of interferons are alpha, beta, and gamma. So antiviral drugs for interferons are alpha and beta interferons are produced by all the cells in response to viral infections. Gamma interferons are produced only by T lymphocytes and NK cells in response to cytokinase immune regulating effects. Gamma has less antiviral activity compared to alpha and beta interferons. Then pharmacokinetics of interferons, what they do? Oral availability is less than 1%. They administers intralesionally, meaning that scar of wherever there is a, in case of that hepatitis, subcutaneous and IV. Distribution in all body tissues except central nervous system and eye. Half-life is 1 to 4 hours. Now, interference adverse effects, they may cause acute flu-like syndrome, fever, headaches. They may cause bone marrow suppressions. They may cause neurotoxicity, confusion, seizure. They may cause cardiotoxicity, arrhythmia, impairment of fertility. Now, the therapeutic use of interferon, they can be used for chronic hepatitis B and C. Complete disappearance is seen in 30% cases. The drug has been gone. Hypervastavirus infection in cancer patients to prevent the dissemination of the infection. CMV infections in renal transplant patients. Condylomate, acuminate given by intralesional injections. Complete clearance is seen. 50% hairy cell leukemia in combination with zidovudine can be used. AIDS-related Kaposi sarcoma can be treated with interferons.
Thank you.
सारा काम ये आपने मेरी स्क्रीन उड़ा दी.
सर ऐसे तो समझ ही नहीं आ रहा था.